The residency process was something that I was really excited to begin, but also extremely nervous, just doubting my own background and abilities. But I think something that's really helpful about the program is that this preparation is built in. I think during the presentations, something that's really important is just to take notes and to make sure that you're listening. And then also just talking to people. For me, I'm someone who absorbs the information that I listen to and I think about it. So if you're able to talk to fellow students who went through the process before, that really helps you. The matching process was something that I was most nervous for, and you're going to hear yeses and nos, not only for yourself, but for your classmates. So I think it's really important to drown out that noise and make sure you're not comparing yourself to other people. Starting residency was, again, something I was very nervous about, but if you work ahead of time with your preceptor and just reach out and try to match your school schedule with your work schedule, that's something that was really helpful for me. My residency is with the Insurance Services Division, and a lot of our education is really health services based. We do have a little bit of exposure to insurance. So I think the program really helps give you the full scope of healthcare and how the provider side, which we kind of more focus on, and that side really contributes to the payer side. Whenever you're learning in the classroom, it's very academic. We are applying it in kind of these simulation scenarios, but the residency has taught me how to think strategically and how to apply that to an organization. I think that strategic thinking is something that helps you in the classroom because now that you are applying it in a real world setting, you can kind of start thinking that way in the classroom. The whole experience has changed a lot from the beginning. So UPMC as a whole has undergone an organizational change. So I lost my preceptor due to a layoff, and I now have a new preceptor. So I think it's thinking on your feet and really being able to adapt. And that's something that you're not necessarily going to get in the classroom. And that's something you don't expect going in because you think it's going to be a perfectly clean and curated process, but things do happen. And I think learning from the leadership that I'm exposed to of how to deal with those things is something that's really, really important